speaker. And Dr. Arvind Gupta is a very eminent endocrinologist, very popular in the state of Rajasthan and famous throughout the country. He made immense contribution in the field of lifestyle-related health issues, primarily the diabetes and obesity. So he has been recipient of various awards. They are being listed here. And some of them we see that he has been recipient of gold medal in FRSSDI oration gold medal in Hyderabad, Naresh Bhu oration, and this is Society for the Study of Diabetes in India. Then he has been recipient of KG Nair oration, that is being given by Indian Society of Hypertension, New Delhi, and for Outstanding Services Award Diabetes in 2019. CD Srinivas oration was also given 2019. So Professor Gupta is also attached to Fortis Hospital, Dr. Bilal Institute of Biotechnology is the member of their advisory for clinical research, and he has undergone training, special training at All India Institute of Diabetes in Mumbai, and he started his career as a consultant in medicine and chaired several of the national, international platforms, organizations, and above all, I would say that Dr. Gupta is a very, very good speaker. So I would not like to take more time in cutting short the slot available for his presentation, and I would request Dr. Arvind Gupta to please deliver his lecture addressing the issue of diabetes and obesity, and with which we all know that how big it is a problem at the international scenario. And his presentation, I am very sure, will update all of us about the how we should know at early stage that we are suffering with it, how should the early treatment modalities, and if there are any myths about that, that can also be addressed. And while talking to him, he said that he will be very pleased to also respond to the questions from the audience. So with this brief, I now pass it on to Dr. Arvind Gupta and request him to deliver his address. Thank you, Professor Dr. Arvind Gupta.
Thank you, Professor Lohiya, for your kind introduction. Can I have my presentation? Can I share? Yeah. Yeah. Do you see my screen?
Yes, sir. Yes, sir.
Not yet.
Sir, we can see.
Yes, sir. Sound is okay.
Right.
Sorry, technical.
No problem, sir.
Screen.
Yeah. So go to present now.
Yeah, yeah. Now you can see my presentation? Can you see
Yes,
now?
sir. Yes, sir.
Yes, yes.
Go to slide mode,
Full
sir.
screen.
Yeah.
Yeah. It's okay now.
This is full screen. Thank you.
Yeah, okay.
Thank you, Professor Lohia, for your kind introduction. And I thank all the dignitaries who are just present for this presentation. I think this is very, very important from the point of view of the country, that we are facing two epidemics at present. One epidemic we all know, it is a COVID epidemic for almost last 2 years. And the second epidemic which is going on at present, not only in India, but all over the world, that is the diabetes. And simultaneously, it is the third epidemic, which is also going on simultaneously, is the obesity. Dear friends, I think we have to be aware of this particular epidemic, and this is a very serious affair from the country point of view, from our own society point of view, from our own individual point of view. Dear friends, let us see the history of diabetes, and we should be proud of our own history, that diabetes was known not only from the modern India, but from the ancient India, where the Charak Samhita, Shushruta Samhita, Brahm Samhita, they have already diagnosed and they knew everything about the diabetes. Not only they knew about the diabetes, but they knew how to tackle and how to manage diabetes at that point of time. Unfortunately, we have forgotten our ancient science, and now from the Greece, when the first time the people from the Greek, they diagnosed the diabetes, and they thought that diabetes is there in the body. And from the modern point of view, they were the Greek, but from the ancient point of view, the Indians and the Charak Samhita and our own Upanishad and everything, they knew about the Madhumeha. Madhumeha means, Madhu means meetha, and Mehe means rain or barish. So it is the urine which is meetha, and that is the Madhumeha. Dear friends, it is a global emergency. This is the recent data from the Indian Diabetes Federation, which was released in 2019. And what this IDF Atlas says to us. Currently, we are facing a big epidemic of diabetes. That is 351 million people of working age, around 20 to 64 years, with diagnosed diabetes. 700 million adults will have diabetes by 2045. Think of this massive increase in diabetes in 2045. But at present also, we are having the same epidemic. So if you see where is our country as far as number of diabetes are concerned, we are having at present, this is the 2019 data, which is 77 millions. But I think at present, we are having more than 80 million people with diabetes in India. And we are at present, we are very happy to say that we are number 2, at least in the number of diabetics in the world. China is having number 1 as far as number of diabetes are concerned. Not only the number of diabetes is important, dear friends, but it is the undiagnosed diabetes. More than 50% people in India are suffering from diabetes, but unfortunately, they do not know that they have diabetes. This is the state of affairs of the diabetes in our country. We have done one recent study, which is known as ICMR in Diab study. Probably few of you must be knowing about this study, which is one of the largest in the world. This study was done in around 30 states of the country, and just a week before, we have published our ICMR in Diab article in the Lancet, which is one of the most respected journal in the world. And what this study says to us. Now, I am talking about the Rajasthan especially. And if you see the Rajasthan data, diabetes is okay. As far as the total number of diabetes are concerned, it is 5.7%. The urban Rajasthan has around 10% of diabetes population, and the rural Rajasthan is having around 4% people suffering from diabetes. But what is more striking to the country, when I presented this data to the ICMR body and the health ministry of the country, they were actually surprised to see that as far as number of diabetes are concerned in developing state of Rajasthan, it is 5.7. But if you see the last one, it is the pre-diabetes. Pre-diabetes is the state where the blood sugar is between, fasting blood sugar between 100 to 125, and postprandial or post-glucose blood sugar is between 140 to 199. So what is pre-diabetes means? These people are not having any symptoms of diabetes, but they are the future people who can develop the lifestyle modification, etc. So pre-diabetes, if you see in the Rajasthan, it is around, urban area is having 17%, and rural area is not far behind, it is 14.7%. And if you see overall pre-diabetes in Rajasthan, it is 15%, which is very, very high. And if I can compare all the 30 states in the country, we are among the first 5 where pre-diabetes is one of the highest. Dear friends, we are sitting on the volcano of our diabetes. It can erupt at any point of time if we are not observing the proper lifestyle modification. So this is the Rajasthan. And if you see overall the country is actually having the similar kind of data all over the country. Why we are concerned with the diabetes and obesity? Because if you see this data, 50% of the 2 million annual cardiovascular deaths in India could be due to overweight and obesity. Think of this particular entity in the country. So if I can talk about the obesity in India, as far as National Family Healthcare Survey is concerned, this is a little bit older one, but this is again striking. 16% of the Indian women are overweight or obese. 12% of the Indian men are overweight or obese. Think of this particular chunk of disease in our country. Obesity can be diagnosed very easily, dear friends, and we are actually diagnosing obesity by just simple measurement of body mass index, which is nothing else. It is the weight divided by the height in meters square. And what is the criteria for diagnosing obesity? The normal obesity is between 18.5 to 24.9, which is average. But if you have a below 18.5, you are actually underweight. If you are having 25 to 29 body mass index, then you are definitely overweight. And obesity is properly, it is more than 30 BMI. But if you have a more than 35 BMI, it is extreme obesity. So what is the concern about that thing? If you see the risk of comorbidities, obesity is okay, but whenever you have obesity or overweight, you have increased chances of having comorbid diseases simultaneously. Not only this, if you can diagnose even with the simple waist measurement, and this is extrapolated by several methods, even X-ray and DEXA scan and everything, just a simple measurement. Dear friends, you just have an inch tape and just measure your waist circumference. For the man, if you have a more than 90 centimeters, you are definitely overweight and obese. And you are having more risk of having diabetes as well as the cardiovascular disease. Similarly, for the women, if you have a more than 80 centimeters of waist, I think you are definitely having more risk of having cardiovascular disease and diabetes. So what is the importance of weight gain? just simple data, just say a 5% weight increase is associated with 33% increase in diabetes prevalence. Just a simple 5% increase in weight can give you the chances of diabetes more than 33%. And just if you see, have the 1.5 times of your body mass index, you are having 90-fold chances of having diabetes, 40-fold chances of having diabetes incidence in men, and also you can have the ectopic fat at many other parts of your body. What is more important for the Indian, it is known as typical Indian phenotype, or I can say it is an Asian phenotype. And if you see, compare with our Caucasian counterparts, we are having more of the abdominal obesity, which is known as visceral obesity. And that's why we are having more prone for diabetes. We are more prone for cardiovascular disease, hypertension, and other non-communicable diseases. And this is all because of the abdominal obesity. And this is our own study. This is known as Indian Heart Study or Jaipur Heart Watch study, where the men had 3.2% rural and 41% urban people are having this obese abdominal obesity. Now, what is more important today for today's scenario, that it is a diabetes and obesity, they are actually combined. And that's why it is a new nomenclature these days. It is known as diabesity. And what is diabesity? It is the obesity combined with the diabetes. So diabetes, obesity, hypertension, your cholesterol abnormalities, they actually have the combined syndrome known as metabolic syndrome. And why this metabolic syndrome is important? Because if you have a metabolic syndrome, you are having more chances of developing cardiovascular or coronary artery disease. Dear friends, I just told you about the Asian Indian phenotype. And it is just as simple. If you have a belly, if you have this typical visceral obesity or abdominal obesity, this is an Asian phenotype. And that's why we are having more risk for developing diabetes as well as the cardiovascular disease earlier, young age as compared to our Caucasian counterparts. Just for a simple example in front of you. Just if you gain 3 kilograms weight, probably chances of developing or increasing the HbA1c, which is a marker for diabetes, it is 1% increase. So dear friends, the more you gain weight, you are having more chances of having the more HbA1c or more diabetes. So why we are concerned about obesity, now I am talking about obesity. So if you have obesity, dear friends, you are having more chances of developing so many complications earlier. Yeah. So if you are having this type of, obesity or even simple overweight, right from because you are having more risk of chances of developing stroke, cataracts may be more, you are more risk of having coronary artery disease, diabetes, cholesterol abnormalities, blood pressure increase, you may have a more chances of developing pancreatitis. Dear friends, not only these things, but cancer, whether maybe breast cancer, uterus cancer, cervical, colon, esophagus, pancreas, kidney, prostate, you are having more chances of developing cancer. You can have a phlebitis, you have a pain in the legs, you can have more chances of having osteoarthritis, gout. Not only this, the females or women may have more gynecological abnormalities. The chances of developing gallbladder stones and gallbladder disease is more in overweight and obesity people. And this is the newer entity. I can say it is a non-alcoholic fatty liver, or commonly called as fatty liver. Dear friends, whatever you eat, they actually go into as a fat, it absorbs as a fat, and mostly it is the free fatty acids. And this free fatty acid deposited in the the liver, and they may lead to non-alcoholic fatty liver disease or NAFLD, which can lead to later on steatosis, cirrhosis of the liver, and most liver disease. Not only this, if you have a obesity, then you have more chances of developing pulmonary disease. You can have one very important thing. You have seen so many morbid obese people. They are sitting in front of you and they are just dozing off. They are known as obstructive sleep apnea. Just simple sitting in front of you and they are sleeping in front of you. This is all because of the obesity. Dear friends, these are the complications whenever you have more chances. You have the obesity. Dear friend, now I want to talk about a little bit of the diabetes. In a simple language or simple terms, what is diabetes? Means sugar is increased in your blood, and the reasons may be basic two reasons. Either your body is not able to produce the insulin, which is through the beta cells of pancreas. So that may be because of the deficiency of the insulin that you may develop diabetes. Another thing, sometimes you are obese, your pancreas or beta cells is producing enough insulin, not only the enough insulin, but it is known as hyperinsulinemia. In obesity, obese people, it is a hyperinsulinemia. But this insulin, which is produced by the beta cells of pancreas, is not able to neutralize. So it is in the peripheral because of the insulin resistance. Maybe it is in the skeletal muscle, maybe into the adipose tissues. So this may be reason of that your body is not able to utilize the insulin, which is known as insulin resistance. So these are the basic two reasons. So if you see here, in a normal situation, whatever your insulin is produced by the beta cells, it combines, it takes the glucose inside the cells. And if you see the type 1 diabetes, that means the children who do not have no insulin, their glucose is never neutralized, not going to the cells, going directly into the blood, and ultimately it filters through the kidney and goes into the urine. This is type 1 diabetes. And type 2 diabetes, I told you, there is a deficiency of insulin. So some of the glucose is neutralized and goes into the cells, giving you the energy. But rest of the glucose, which is not neutralized by the insulin, which is deficiency of insulin, this glucose goes directly through the kidney and ultimately excreted through the kidney. The third one, diabetes, is known as, this is again very important and gaining very high significance in the country. It is the gestational diabetes or gestational diabetes. And it is because of your blood sugar is high in your mother that may lead to the diabetes for mother, as well as it is actually detrimental to the developing fetus. So this is the gestational diabetes, which is very important these days. Now, if you can say just a little bit about the physiology of glucose, I think whatever we eat, it actually, whenever it is absorbed into the three forms, the proteins, the carbohydrates, and the fats, the proteins converts into the amino acids and utilized for our tissues and other body parts. The fat, which is absorbed as fatty acids, that also deposited into the subcutaneous tissues and some of the organs. But the glucose, carbohydrate converts into the glucose, it enters into the blood, and whatever the pancreas produces or beta cell produces insulin, this glucose combines with the insulin, goes to the tissues and cells, and gives us the energy. So whenever the problem here in the production of insulin, then you may develop the insulin. So how to diagnose? Very simple thing to diagnose diabetes these days. You have a glucometer these days. You can go for the laboratory. Just fasting sugar, if it is more than 126 milligram%, and if 2 hours after 75 grams glucose, it is more than 200 milligram%, you are definitely diabetic. There is a pre-diabetic condition I told you just now. If you have a fasting from 100 to 125 milligram percent and 2 hours after glucose is 140 to 199 milligram percent, you are pre-diabetic. And this pre-diabetic condition is actually now a condition which most of the people will get diabetes later on. And what is the normal sugar? If fasting is less than 100 milligram percent and postprandial or post meal 2 hours, it is less than 140 milligram percent, you are not having diabetes. But there are several other tests are there like HbA1c, serum insulin, serum C-peptide. You can have, I mean, HbA1c these days is also important as far as the diagnosis is concerned, but it is more important for the prognosis and control of diabetes. If your HbA1c is less than 6.5, you are okay. But if it is more than 6.5, you are having more chances of having diabetes. Now, if you have a diabetes, dear friends, I think this is a simple algorithm. You have to, urine test, we don't do this these days, but it is the blood sugar which should be done at least once in a month, and tell your doctor about your blood sugar, both fasting as well as the postprandial 2 hours. Glycosylated hemoglobin, at least in 3 months, you must do this test, and this test actually guides us that whether you are having more organ dysfunction or maybe more chances of developing complications. So it should be less than 7, but if it is less than 6.5, it is good. But if it is less than 7, it is okay. But if it is more than 7%, you are having more chances of developing diabetes complication. But at least in 6 months, you must do your ECG, your cholesterol and lipid profile, your serum creatinine test, and the liver enzyme test. These are very, very important from the recent drugs point of view, because some drugs are working through your liver and kidney. So we must know at least in 6 months your creatinine as well as the liver enzymes. Dear friends, diabetes does not come alone. Again, you have several comorbidities whenever you have a diabetes. I told you, obese people are more having diabetes. You may have the respiratory problems. You may have more of the gallbladder disease, cancer, infertility, maybe osteoarthritis. Cardiovascular disease is definitely, if you are a diabetic, you are more chances of developing cardiovascular disease. You may have some type depression and hypertension. So several comorbid conditions are there when you have a diabetes. Dear friends, now we can talk something about the risk factors. Why diabetes and obesity is increasing in our country and all over the world. Just see, this is an example. Dear friends, whatever our apes, our ancestors, they are having this type of vertebral column. They are bent. They have the bended here, the vertebral column. And gradually, khana nahi milta tha. They are hunter-gatherers, and they used to go miles for their food. Just for a little food, they have to go miles and miles, and gradually their vertebral column becomes erect. And dear friends, once upon a time, our ancestors were the fittest people on the earth. Means their vertebral column was absolutely erect. And this was the fittest person. But gradually what happens? Gradually, dear friends, you are having now food at your home. Your food, everywhere availability of food is there. You don't have to go, you don't have to even cook. So this is the problem. So if you are having this type of now obesity and diabetes developing, I think please,
Can't hear you, sir. Dr. Arvind can't hear you.
Please unmute.
Dr. Arvind can't hear you.
Dr. Gupta, please unmute.
Dr. Arvind, you are muted. Please unmute yourself.
Yeah. Okay. Now you see my slides, and am I audible now?
Yes, sir.
Okay. Okay. Yeah. So what I was talking about, dear friends, that the availability of food was there, abundant availability of food at your doorstep. Just Swiggy ko or Zomato ko aap phone kariye, and you can get your whatever the food you want from anywhere joints. You can have your food at your home. So even don't have to cook your food. And this is the state of where you are getting obesity. Dear friends, not only this thing, the people now are going to mobile, internet, TV, and what you see here. Now again, हम जहां से चले थे वहीं पे वापस पहुंच रहे हैं, dear friends. And I am telling you, I see almost daily patients, younger patients, having this backache problem. And because of the long sitting in front of the computers, they are having this type of problem, the backache problem. These problems are because of the sedentary habits we are getting. We are not going out, we are not having exercise, we are not having any walking. Lifestyle is getting totally sedentary. So if you compare from ancient to modern diets, the availability, see, whatever the food you want, it is in front of you. Previously, this is the state of affairs. They used to actually go and cultivate the agriculture, but nowadays see the computers. Previously, we used to go on walking or sometimes, running, but now abundant cars and vehicles are there. We don't go even for a small walk these days. And just see what we are getting. हमें जो fruit मिल रहा है इस lifestyle का, जो modern lifestyle का, and the fruit is getting obesity, diabetes, and actually most of the non-communicable disease. So the weight gain कैसे हो सकता है? The dietary pattern versus activity pattern. This is very, very important. I'll talk a little bit later. And we have a wrong choice of food. Dr. Vidya Jain is here, and she will give the example. Maybe in the last, I can ask her, because she has done a tremendous control on diabetes and obesity, which is phenomenal. So you have a wrong choice of food. You don't have a portion control. Sensory specific satiety, that is very important. What food you are eating, जो जल्दी से satiety करता है, और कुछ food ऐसे होते हैं जो they don't have any satiety. You take lot of things and you don't have satiety. And of course the sedentary lifestyle. Dear friends, just for example, you are just eating one packet of chips, and what this 100-gram chips gives you 540 calories. Dear friends, हम अपने patients को we are giving for 1500 calories to our people, or around 1600 or 1800 calories. Just a simple pack of potato chips gives you 547 calories. What you are getting? If you want to burn these calories, you have to walk 2.1 hours, 12 kilometers. Jog 1 hour or 80 kilometers. Then and then you will be able to burn this much of calorie. Oh my God. 2 samosas, 400, 700 packed, calorie-packed food, Indian fast food. What you are getting? The 700 calories. And you have to walk 162 minutes to burn this 700 calories, 15 kilometers. Oh my God. Again, Burger King, the 480 grams of this particular, which is very famous, popular with our youngsters. And what you are getting around 100 to 1250 calories, which is very, very high. And you have to actually walk 5 hours to burn these calories. Oh, again, very popular with our youngsters. Pizza. And this actually gives a more than the daily requirement of your calories. It is 2000 calories. And you have to work at least 8 hours to burn this 2000 calories. See, this is a state of affairs. Dear friend, this is known as affluenza. हमारे पास enough money है to buy the food. We have enough things to, things that. So we are actually having more calories in our diet. We are having less physical activity and more of the urbanization. This is typically known as affluenza. Dear friends, the risk factors for diabetes, there are two types. They are non-modifiable. जिसके लिए हम कुछ नहीं कर सकते. If you are having more age, if you have a genetic or family history of diabetes, if you have a history of gestational diabetes, if you are obese, you are polycystic ovarian syndrome, you are having acanthosis nigricans, this is non-modifiable. But dear friends, there are so many modifiable risk factors like dietary factors, abdominal obesity, overweight, and physical inactivity. You can do much thing and you can control these modifiable risk factors. So these are all the risk factors. Dear friends, you have to be concerned with this type of risk factors. So now how to diagnose? These are the classical symptoms of diabetes. This is known as polyuria, polydipsia, polyphagia. Means if you are having a bar urine ho raha hai, increased urination. If you are having more thirst, don't worry about this chilly hot these days. This scorching hot these days. वहाँ पे तो आपको ज़्यादा प्यास लगेगी. It is okay. But if you are abnormal thirst, then you are having more chances of the symptoms of diabetes. And in spite of your, you are taking good food, you are still feeling hungry. That may be a sign of or symptom of diabetes. The other symptoms, if you are unexpected weight loss, कभी family में एकदम से कोई आया और आपको बोला कि एकदम से आपने weight loss कैसे किया है, that may be a diabetes. Extreme fatigue, घर पे आके कहे कि मेरे को पैर दबाइए, and you are asking your children to to say something about your legs and pain in the legs, that may be extreme fatigue. Frequent infections are there. If you are having wound and it is not healing, but you are having also tingling numbness in the hands and feet, maybe chances of, you may be having a diabetes. And sometimes suddenly you are having blurred of vision. You are not seeing properly your things. Then also you go to your doctor, test your blood sugar, maybe you have a diabetes. So these may be the reasons for diabetes. So why we should treat diabetes? That is $1 million issue. Dear friends, if you will not control your diabetes, the blood sugar is increased, HbA1c is more, then you are having more chances of developing micro and macrovascular complications. Like in the eyes, you may have a blindness or decreased visions. In the kidneys, you may, you have a renal failure sort of thing, which is known as diabetic kidney disease. In the nerves, it is a neuropathy. And I am telling you, I am seeing those patients, we are having tingling numbness, the pain, excruciating pain in the feet, that may be a neuropathy. In the heart, your major arteries, coronary arteries are involved, that may be a coronary artery disease. In the blood vessels, you can have a more paralysis. In the peripheral arteries, these days we are seeing the gangrene sort of thing, or peripheral artery disease known as PVDs. So if you are not able to control your blood sugar or diabetes, probably you are having more chances of developing these complications. And if you see, this is the state of affairs in our country. They are getting more and more complications of diabetes in the form of heart disease, peripheral vascular disease, retinopathy, or known as blindness, nephropathy, and even neuropathy. Dear friends, one of the important leading cause of non-traumatic lower limb amputation is the diabetes. Dear friends, very simple thing I want to tell you, that what are your targets? Just simple targets. Your fasting sugar between 90 to 130 milligram %, your postprandial should be less than 180 milligram %, and HbA1c should be less than 7. But if you can go up to 6.5, this is better. Now, these are two questions. I think you will ask me these two things. Can diabetes be cured? And I think all the dignitaries are here, dear friends. You will be asking me, can diabetes be cured? Now, these days, एक नया term आ रहा है, reversal of diabetes. I'll talk a little bit of reversal of diabetes in the end, but can diabetes be cured? I think, as far as I am a scientist, as far as the science is concerned, I think we can control the diabetes, but at present, there is a no cure. You can have your reversal of diabetes means you can actually control your diabetes without medications, maybe by lifestyle modifications, calorie restriction, and intermittent fasting. That may be and these days, if you have a morbid obesity, if you are going for bariatric surgery, this is one of the data that 72% of the patients with type 2 diabetes with obesity, if you go with the bariatric surgery, they have a complete control without having any insulin or any oral anti-diabetic drugs. But before you go with the reversal of diabetes, what are the aims of diabetes management? हमें क्यों control करना है? The first thing is that we have to have a good quality of life. And if your sugar is controlled, you will lead a very good quality of life. You should have a prevent or delay the complications. If you are controlling your diabetes well, I think you will be able to prevent or delay your micro and macrovascular complications, just we have discussed. So, dear friends, can we prevent diabetes? I think my question is yes. My answer is yes. If you maintain your body weight, that is first thing. If you have a very balanced diet, आपको त्याग करना पड़ेगा. हमारे संतों ने बोला है, कुछ त्याग करने से प्रथम कुछ त्याग करने का रहा सनातन से रहा धर्म. यानी हमें बैलेंस डाइट, सामने खाना देखा और एकदम खा लिया, दिस इज a very bad thing. I mean, seeing your food and gulping like anything, this is a bad thing. So you should have a balanced diet. Do not overeat or overeat. That is important thing. Include your fresh fruit and vegetables in every meal. I'm just giving you one example. There is one study published in British Medical Journal. This is a study of 20 years, and they clearly, suggested to us that if a person who includes one vegetable, green vegetable, and one fruit a day can reduce to diabetes, obesity, and cardiovascular disease by up to 46%. Just simple one green vegetable and one fruit a day. Avoid sweets and fried fruits. हमारे यहाँ every week there is one festival. Dear friends, please restrict to your sweets and fried food at least, because it contains too much of calories, and I gave you the example of calories. Reduce intake of fried and junk foods, of course, and then the most importantly, it is the physical exercise. If you can do your 30 to 45 minutes per day of your regular walk, brisk walk, that is the more than sufficient. And I'm giving you just one example here, that what your exercise or physical activity gives you, that gives you happiness. And how happiness is through the physical exercise? You generate endorphin. एक hormone होता है, endorphins, that is equivalent to your happy hormones. And that only can be generated by a physical activity or regular walking, brisk walking by 30 to 45 minutes. If you want to become happy, real happy, then you can just go for 30 to 45 minutes of walking. And dear friends, if you have a diabetes, you should have a proper diet. अपने dietitian से मिलना. I'll talk just now. Exercise is very, very important. Oral agents, monitoring of sugar, insulin. If you are advised insulin, I think don't argue with the doctor that I don't want insulin, because insulin is, if you have a deficiency of insulin, your oral agents are not able to control the diabetes. Insulin is a must. And of course, you must know and educate yourself. So there are several things you can go with the diabetes. So you have a diet, proper diet, exercise, oral agents. So these are the very important. And of course, these are the things, yoga and group, therapy sessions, laughter clubs are there even in our Jaipur and all over the country. And of course, meditation is one of the important things by which you can control your diabetes. This is a common thing in our present day society, modern day society. आप कोई भी हो, whether you are a child, you are an adult, you are a middle-aged or elderly, you have a stress. We have a stress right in the morning. जब उठते हैं, we think of so many things and हम आज कैसे करेंगे, क्या करेंगे. So that is, I mean, stress is everywhere. So there are two types of stress. One stress, I can say that it is a good stress is a good thing by which you are actually motivated to do your work, but you have over stress, then it is not a good. So if you have that type of bad stress, then you can have actually relax yourself, go meditation. I mean, simple music you can hear of your choice. You can have your gardening. You can have at least 30 to 45 minutes of walking and try to modify your lifestyle. That is very important. So dear friends, I mean, we have to change our habits. If we do not change our habits, we'll be having this type of pot belly. So how to manage your weight? What is the advantages of just 10% weight loss of your basal weight loss? Just 10%. Dear friends, you can have HbA1c reduced by 15%, cholesterol reduction by 10%, diabetes-related deaths by 30 to 40%. Your risk of diabetes development is less than 50%. You have a reduced insulin. If you are taking insulin, your insulin requirement will reduce. Your blood pressure will be controlled by around 10 millimeter of mercury, just weight loss, no medication. Fasting glucose reduction by 30 to 50%. Total cholesterol by 10% reduction. LDL, which is a very harmful cholesterol, reduction by 15%. And triglyceride, again a very harmful cholesterol, reduced by 30%. Dear friends, what else you want? Just 10% of weight loss can do a wonder in your day-to-day activities. Then so many improved your health. I told you some of the bad things about the obesity and diabetes. So if you control your weight just by 5 to 10%, you can have control of many of the diseases. 10 to 15% of weight loss can reduce your osteoarthritis, obstructive sleep apnea, non-alcoholic fatty liver disease, even the dyspepsia. And if you reduce more than 15% of weight loss, I think your cardiovascular disease reduce, non-alcoholic fatty liver reduce. You can think of remission of diabetes. Dr. Vidya Jain is here. She is hearing this particular aspect, that remission of diabetes is through the weight loss. That is more important than any other thing. Dear friends, I'll be talking, just taking little time of yours to just concentrate here. Now, because this is my research area, so I'll talk little bit detail about the diet. Diet should be individualized. Means ऐसा नहीं होना चाहिए कि हम किसी को force करना है. We don't want to force anybody to eat that particular food. That should be realistic. Flexible. It should be flexible. Patients' likes and dislikes. That is very important. Whatever, some food you do not like, and if I can say as a doctor, no, you have to take this food. Probably for a few days you will take and later on you will discontinue. But it suits to your lifestyle. That is very important. So the most important thing is, dear friends, I am giving you just tips for your controlling your diabetes and obesity. Just a simple calorie restriction. What should be your ideal calorie restriction? For ideal body weight, it should be around 25 to 30 calories per kilogram per day. What this means, for a 60 kilogram person, that should be around 1500 to 1600 calories per day. That is thing. If you are underweight, probably you can take little bit more calories. If you are overweight, you have to reduce your calories. But if you are elderly population, elderly more than 80 years of age, probably require less calories as compared to adults. Now, this is just for example. I told you just earlier also that please think of these particular things. जो थोड़ी बहुत खा लेते हैं, but it gives you too much of calories. Your kachori samosa, which is a, I think, staple part of our North Indian population. Poha, matri, papdi chaat, potato chips, imarti. Just one imarti gives you the 500 calories. And if I want to give you 1500 calories, think of, can you reduce your weight? Can you reduce your, control your diabetes? Probably no. Now, this is again very important. Dear friends, breakfast is a must for each and every person on the earth. That is very important. Your breakfast should be 1/3 of your total calories. जो लोग regular breakfast लेते हैं, this is also one of the study published in Lancet, that the people who are taking regular breakfast can reduce their cardiovascular disease, hypertension, diabetes. Simple breakfast. Take breakfast right in the morning. Delay नहीं करना है 9 or 10 o'clock. It should be around 8 or 8:30. You should have your breakfast. 1/3 of calories. Good breakfast will give you the happiness and energy whole day. Then lunch should be okay, around 30%. Evening snacks is very important, and dinner should not be very, very heavy. So breakfast is 1/3, lunch, evening snacks, and dinner, you divide your 2/3 calories as per your other schedule. Now, what is healthy plate? जब आपके सामने प्लेट आती है, तो सामने 3-4 things ingredient आपकी थाली में प्लेट में होना चाहिए. Vegetables, very important ingredient of your plate. Fruits, whole grains, and healthy protein. Dear friends, Dr. Anup Mishra from from Delhi has done one study in India, and he found that 66% of the Indians are having protein deficiency, especially the vegetarians have the protein deficiency. So please increase your intake of protein, because we are all having sarcopenia. हमारे सबकी muscles खराब. So what is healthy versus unhealthy food choices? Just for example, in front of you, this is green zone, yellow zone, and red zone. Now, about the rice, बहुत सारे लोगों को होता है, steamed rice is okay, your pulao is yellow, but your fried rice and biryani is red. Now, as far as bread is concerned, यदि whole bread जो choker के साथ लेते हैं, that is a good. But if you are taking white and other cakes and pastries, this is not a good thing. Noodles, steamed noodles are okay. Indian bread, chapati, जो whole grain chapati, this is the best food as compared to Mediterranean food, which is thought of the one of the best diet in the world, Mediterranean diet, and it is equivalent to our Indian chapatis. Potatoes, I think, as far as baked potato is concerned, this is okay. But if you are taking fries and the mashed potato, not good. Vegetable, steamed vegetable is okay. Salad is important ingredient. Your tomato is okay. But if you are non-vegetarian, your steamed fish and grilled chicken is okay. But you are taking butter chicken, this is not a good thing. Now, हम लोग कैसे divide करते हैं? We divide our food into 3 categories, basically, depending on your glycemic index. What is glycemic index? Means whatever food you are taking, it converts into the glucose. That is a glycemic index. So if you are high glycemic index food, that is dangerous. Intermediate glycemic index, okay. And low glycemic index food is probably the best for your sugar, both for diabetes as well as obesity. Like class 1, higher glycemic, maida, bread, sugar, cornflakes, grapes, chiku, custard apple, mangoes, they are having high glycemic index. Intermediate glycemic index, okay. Oats are okay. Bran is okay. Rava, idli, and everything is okay. But the lower glycemic index food like milk, these are the right legumes, nuts, rajma, soybean, fructose, all cereals and pulses. Lower glycemic food is okay. So avoid most of the high glycemic food. This is again very important. It should be in your day-to-day routine, known as functional foods. what is functional food? They actually give you the extra benefit of antioxidant property. It reduces your cardiovascular disease and diabetes. Like methi seed, I have worked a lot in my life. Almost 30 years I am working on the methi seeds or fenugreek seeds, and I just want to tell you, it has a very chemical ingredient known as 4-hydroxyisoleucine. So many scientists are here. We have done, Dr. Sarika is maybe here. She has done good work on this methi seeds, and this 4-hydroxyisoleucine or osmotin is probably ingredient which actually very good, useful as far as diabetes control is concerned. Oats are okay. Your nuts are okay. Nuts may be the important thing is not all the nuts are okay, but I think almonds, 5 almonds रात को भिगो के लेने से that is okay, because most of the nuts also contains polyphenols, tocopherols, and they are good antioxidants. Soya, if you are protein deficient people, soya is good thing. Omega-3 fatty acids are very, very important ingredient, should be in your food, and flax seeds, if you can take, this is a good ingredient. Dear friends, this is a food guide for you. If you can take enough cereals in your day-to-day, pulses should be enough. The fruits and vegetables should be enough. Then milk product, okay, this is okay. But meat products and the sweets and fats, please, this is the tip of the pyramid. Please don't take these things. So avoid, as far as the tip of the pyramid is concerned. The base of pyramid is the best food you can take. Now, these are the different diet components. The carbohydrates are very important ingredient. The fruits, vegetables, and salads. Then the proteins are very important. The pulses, the milk, and if you are non-vegetarian, then you can have this fish and things. Then fats, you have to take the moderation. Now, just for fats here, dear friends, यहाँ पे एक just tip देना चाहता हूँ कि 3 teaspoonful per person per day is enough. यानी 15 grams of your total cooking fat is enough for a day. So it should be around half a kilo per person per month. So if you have 4 persons in your family, please bring only 2 kilograms of total cooking fat. That is enough. So half a kilo per person per month. Remember this thing. Now I told you about the breakfast. It is a must for each and every person. If you want to have energy whole day, you should have at least 1/3 of the calories in the breakfast. You can have your choice of breakfast, maybe dalia, idli, dosa, fruits, roti, depending on your things. Lunch should not be very, very heavy. It should be a balanced meal containing the plates. I told you, so many ingredients should be there. Dinner should be very light, dear friends. It should not be very, very heavy, because that gives you, I will give you some of the why I want to give the heavy dinner. Now, snacks are again important, because if you are diabetes and obesity, you are having more appetite or something thing. So you choose your snacks which has the less calories. So vegetables, I think these are the vegetables you should avoid or take in a less amount. Fruits like apple, orange, you can take this, papaya, the pears and all these things. This is okay. These fruits are okay. I'm happy to give you any fruit of your choice, except the high glycemic index fruits. Most of the fruits you can take, but like banana, mango, I think season is mango. मुझे अभी सब लोग कहने वाले हैं कि भाई you are telling this thing to us, and these are the fruits. You can take in a less amount. That is, I can say at present. Now, more vegetables, dear friends, fruits, and these are what I am telling you about. These are the real ingredients in your day-to-day diet. So, complex carbohydrates. यदि आपको लेना ही है, तो you should have this high complex carbohydrates. Complex carbohydrate means they convert into the sugar late. So first these are the polysaccharides, they convert into disaccharides, and then disaccharides will be converted into the monosaccharide. Monosaccharide is glucose, disaccharide is fructose, and polysaccharide is a sucrose. These type of things. So you have more choice of having polysaccharides or complex carbohydrates. Now, if you are a vegetarian, you will definitely ask me what type of vegetarian sources. I think this is important, which I want to tell you. Just a 1 glass of milk. You can have little bit of cheese or something. Then you can have a good amount of pulses, at least 30 grams, 20 grams of like chana and this thing. You can have paneer. You can have a curd, good thing. If you are non-vegetarian, you can take egg, but also the chicken. So I think this is a good source for vegetarian source, and non-vegetarian source is there. And you can take your, good vegetarian source of proteins. At least protein is a must in your Indian diet, because we are actually deficient of the proteins. Now, quality of fat is important. And I told you just there are different types of fats. Monounsaturated fat, polyunsaturated fat, and it is the omega-6, omega-3 ratio, which is very important. And just I want to tell you about the oil. The best oil for your thing is the mustard oil, which has the best omega-6, omega-3 ratio of less than 1.5 to 1. If your ratio is more than 10, it is very dangerous. So these days, our dietitians and dietetics association, they say, go with the change. Like हमारे ancestors or predecessors क्या करते थे? They used to cook some oil in, some vegetables in some oil, some vegetable in other oil. So you can blend your oils, don't stick to one oil. So that is the best idea of changing the oils on a regular basis. But the important is that trans fats, dear friends, this is the most dangerous thing for your cardiovascular disease, diabetes, and obesity. The trans fats means your bakery products, your margarine, vanaspati, dalda is the most dangerous thing. Donuts, your different types of Indian food like samosa, bhajia, French fries, these all contains trans fats. Please avoid trans fat at any cost. That is very important. Now, the last thing about the how to cooking. I think we have so many ladies here. Please, this is for you people, that healthy cooking. Khana bhi le liya, but your cooking practice is not good. That is it. So, take most of the steaming. Steaming is okay because you don't lose so many nutrients. If you are steaming your food, you can stir fry or saute, or your like appam maker or grilling. This is okay because you don't lose much of the nutrients by having this type of cooking practice. Yeah. So now this is very important, dear friends. This is at what time we should eat our food. That is very important. 3 years back, the Nobel Prize was given to the people who actually developed this type of human circadian rhythm, and they told us that if you are eating before dawn, before sunset, then you have the less disease. And this is what I want to tell you here, that the important thing is melatonin. Melatonin is one of the important hormone, and is just see here that your melatonin secretion starts here. Your like at this particular point of time, late in the night, you have a late digestion. Your digestion is very poor during this period, and you are eating late in the night and midnight. Probably you develop more diseases because you cannot digest your food at that particular time because of lack of the enzymes, slowing of gastrointestinal motility, and most of the things. So, and right in the morning, the sunshine is there, the melatonin is, there is nothing like this, and this is the best time for working. So what is the best time for your best coordination? This is the morning hours. This morning hour is the best If you want to actually do something, propose some projects or something, the best coordination time is the morning. Greatest cardiovascular muscle strength is this time, particularly around 11 o'clock. Highest blood pressure occurs at this particular time. So, I mean, your body rhythm is there. So, dear friends, please eat early in the evening, not late in the night, if you want to prevent or delay the complications or as well as the diabetes and things. And these are the two things I want to tell you. The refined food or refined oils, they are not very good. They are the source of oxygen-free radicals. They are the source of trans fatty acids. Please refrain from too much of refined foods and the fried food. Dear friends and my ladies here, the most important thing is what you do is the reheat of the oil and reuse of the oil. Most of the ladies जो रात को खाना बच गया सुबह उसी ऑयल में दोबारा उसको रीयूज करते हैं. सो व्हाट इज हार्म? जो ठेले से हमें और जो बाहर पहुंचे वालों से मिलता है वो बार बार रीयूज और रीहीट करते हैं ऑयल को. दे डेवलप VDPs. व्हाट इज VDP? इट इज volatile decomposition products, very dangerous chemicals and other chemical like acrolein. तो जब भी कभी आप ऐसे फूड रेगुलर खाते हैं colon irritation होता है and even colon cancer is attributed to this particular the people who are taking too much of reheating of oil or reuse of the oil. Please you'll use non-sticky pan. And little bit about the sweeteners. Most of the people who are very sophisticated, they are thinking that now I am taking artificial sweetener. Dear friend, there are two types of sweeteners, artificial as well as the natural sweeteners. So artificial sweeteners are chemicals. They are not good. They can do so many harms in your body, including epilepsy, including phenylketonuria and so many things. Natural sweeteners like fruit sugar here, sucralose and stevia is okay, but try to avoid as far as possible most of the sweeteners because they are also not good. Exercise, I told you about that thing. The best thing, you develop your endorphins, which is a happy hormone, and if you want to become happy, you have to go for the 30 to 45 minutes exercise. Targets, I told you. I mean, there are so many things these days. We do the continuous glucose monitoring system, which is a very simple thing. We just put the sensor here on the abdomen or on the arm, and we can monitor by Wi-Fi. Every 1 minute, 2 minutes, we can monitor your blood sugar. We have the technology here. We can do the, if you are having fluctuating blood pressure, we have an ambulatory blood pressure monitoring. I think this is the best thing. If you have a blood pressure which is more in the night or more in the day and you cannot measure, this is a good device. Dear friend, this is my last one. This is the A, B, C, D, E. Please remember these 5 things. A means A1C, your target of HbA1c should be less than 7. B means your blood pressure target should be less than 130 to 80 millimeters of mercury. C means cholesterol, the bad cholesterol, LDL should be less than 100. But I say for diabetes, obesity and blood pressure, it should be less than 70. D is diet. I told you enough about the diet. Smoking is the most dangerous thing. Alcohol is also most dangerous thing. Exercise for 30 to 45 minutes is the best thing. You can have your day-to-day life and you can have a good quality of life. You can become very happy if you measure, if you observe these A, B, C, D, E in your day-to-day life. My last slide. Dear friends, eat less. That means according to your calories. Eat on time. I told you that is very important. Eat early dinner and regular meals in the day. Eat right. I told you what is right and what is wrong. Walk more, 30 to 45 minutes. Sleep well. Again, it has been known that if you are sleeping well, 6 to 8 hours, at least 6 hours a day, you can have a best quality of life. The sleep well and on time. And dear friends, in the last, I think with this smile happy. Always think of yourself as a happy person. Smile always, and then you can have your, good quality of life. सुंदर से नित सुंदरतर और सुंदरतर से सुंदरतम और सुंदर जीवन का क्रम हो और सुंदर सुंदर जीवन हो हमारा. ये हमारे my father's poem was there, and I end with this. Thank you, and I am here for your question and answers.
I think it has been a wonderful presentation, Dr. Arvind.